Thank you, Chair. And if I may address my questions initially to Lord Bethell. A bit of a comment, really, to begin with, if I may. Forgive the background noise. We have a building behind us. One of the things that seems really interesting to me is around data literacy. And I think that over the past year, through the pandemic, people have got more used to data and looking at statistics and analysis and understanding the role of an individual point of data within the context of much more. And I just wonder, with that mindset, whether there's learnings that we could take when we talk about the communications of this, that people get data more, they understand they're sharing every day on social media and all these other parts around their lives. But actually the opportunity to save lives is perhaps the key point. And I look at things like organ donation programs and the communications around this, and whether we should be looking at the communications to be more about data donation. So where you're not just saving one life, but you're saving thousands by donating that data, rather than it being a more technical conversation around opt-in and opt-out. I just wondered what your thoughts were on that, please.
Yeah, I completely endorse that. I think the organ donations example is a good one, but so is the vaccine. A lot of data was used in order to put together the prioritization lists. But my inbox is not full of complaints about people who got the vaccine and wondering whether the data was used in delivering it. It really isn't. I think that the public health literacy that you allude to is right. We wear masks not to protect ourselves, but to protect our neighbours. And for a lot of people, having the vaccine is not to protect themselves, but to protect the loved ones and to protect the community. And there's a lot that people have done in the last year and a half that was, frankly, selfless and was there to protect the community at large. And that's what we're talking about here with the data. The individual benefits of sharing data are minimal. The communal benefits are enormous. And I think people have twigged that that's what being part of a national health system is all about. I agree that at the same time, there is concern about social media and about other uses of data and about how the big tech companies use our data. And that literacy is increasing and the concerns are increasing at the same time. So we have two big related public learnings going on at the same time. But I am really hopeful that as people think more about how their data is used, they will join the communal effort.
And can I ask, thank you, and can I ask just one other question? It's more of a thought, but one of the comments so far has been about anonymization of data. And something that I think I might have mentioned in the House previously, I believe I did, was about the concept of creating something called placebo data. So whereby you automatically introduce 2 or 3 points of data within every data set that's slightly different, so that you could never actually trace it back fully to an individual. And I just wonder whether that's something that's been discussed or thought about.
Can I pass that to Simon Bolton, who is more competent with these matters?
Simon. Yes, please, Simon.
So I'm not quite sure I understood the question.
So imagine giving some of the examples earlier where somebody might be a certain age, certain ethnicity, certain number of children and so on. Are there opportunities that actually to help anonymise data a little bit more, you introduce 2 or 3 variants within everyone's data set that's slightly different, so that then as an individual set of data, they wouldn't directly match that, but actually overall that would effectively become noise, so it wouldn't actually affect the overall analysis, if that makes sense.
So I think it's really important to understand how we're using this anonymised data currently, because actually I think if I talk to the risks that were identified earlier around the opportunity to market to people as a result of data sharing, we simply don't believe that's possible at the kind of scale that was implied, because the way we manage this is we pseudonymise the data. We then have a very rigorous process before we release that to third parties to do research on. We have a contract in place with those third parties detailing exactly what they're allowed to use that data for, and it certainly wouldn't include marketing. And then we do audits selectively where we believe there could be risk, to ensure that they're not using that data inappropriately, that they're not doing things like marketing, which would be almost impossible to do because they'd have to re-identify the data, which they may be able to do in 1 or 2 cases, but they certainly couldn't do it at scale on the data sets that we have.
Thank you.
Does that help? Does that answer the question?
Yes, I think so. It's just more about how do we make sure that it's not trackable back. And the concept of placebo data or something else that's introduced to ensure that wasn't possible.
But in future, I mean, our commitment now is that we will, instead of sharing data externally, we'll do all of that analysis within our own infrastructure within a TRE. So we will be in control of exactly where the data is. So it could not be forwarded, as could happen currently.
Thank you.